Mary Breckinridge is an extremely influential figure in nursing and especially nurse midwifery for her service to rural Kentucky. She began her life on February 17, 1881, in Memphis, Tennessee, according to Mayo Clinic proceedings. She was born into a wealthy, politically powerful family, as her grandfather was James Buchanan's vice president, and her father was a representative for Arkansas in Congress and a U.S. minister in Russia. Because of her father's occupation, she grew up in Washington, D.C. She additionally traveled to many different countries, such as Russia and Switzerland. Her early education was provided by tutors and private schools in Switzerland and Connecticut. After this, she went to live in Arkansas in 1899. Her first marriage was with a man named Henry Morrison in 1904, who unfortunately passed away 2 years later. Because of this tragic death and the illness of a childhood friend, she decided to become a nurse and attended St. Luke's Hospital School of Nursing in New York City and became a registered nurse in 1910. 2 years later, she got remarried to a man named Richard Thompson and taught French and hygiene at the college that her husband was president of in Eureka Springs, Arkansas, for the first 2 years of their marriage. They had 2 children together, but unfortunately, neither of them made it past childhood, according to the American Association for the History of Nursing. This tragedy would come to serve as a reason for Mary's inclination to help mothers and children. After her divorce from Richard in 1920, she worked as a public health nurse and then moved to France to help with the American Committee for Devastated France. During her time in France, she organized a program to help mothers and children and even received a Médaille Reconnaissance Française for her effort. Her experiences in France and with the midwives there made her turn her focus to rural America, especially mothers and babies in these areas. Because of this, she decided to attend the Teachers College of Columbia University for public health nursing and studied midwifery at 3 different British colleges, according to Britannica. On top of this, she also went to Scotland to learn more about delivering health care to isolated populations. After this, she went to Leslie County, Kentucky, to learn about the people and their healthcare experiences. With Leslie County being a very impoverished place, their healthcare services were insufficient. Mary took it upon herself to personally speak with many of the locals about their healthcare and midwife services. According to Maria Smilios, she learned that there were no trained midwives, and everyone who worked as a midwife was young and relied on religion to provide treatment. Mary was disturbed by Leslie County's lack of proper health care and even looked down on untrained midwives. In response to this, she created the Frontier Nursing Service, which was the first American healthcare group to hire nurse midwives, according to Britannica. The headquarters of this organization was later moved to Wendover, Kentucky, at her house. Because they were so poor, they struggled to establish healthcare resources, according to Maria Smilios. Mary combated this challenge and used her connections, wealthy background, and cinematography student niece to put together a documentary about the nursing service, which was very successful and allowed funding for the first hospital in Leslie County, the Hyden Hospital. This region's population was also dispersed, which challenged Mary and her nurses in providing care. Because of this, they had to reach patients' houses by horseback and often had to pack everything that they might need with them in their saddlebags since they wouldn't be able to return to the clinic, according to KET. Mary succeeded in her goal of helping the people of Leslie County, since her actions lowered both the maternal and infant mortality rates below the national average, according to Britannica. Additionally, she succeeded in providing more health care resources and trained professionals to the area, improving health outcomes. Many of Mary's nursing staff at the Frontier Nursing Service were from Britain and wanted to go back home once World War II started, leaving the Frontier Nursing Service understaffed. With there being no midwife universities in America and being unable to send people to Britain to receive education due to the war, Mary had to come up with a solution. This came in the form of founding her own nurse midwife university, named the Frontier Graduate School of Midwifery. According to Frontier Nursing University's website, they enrolled their first cohort of students on the 1st of November, 1939. The Frontier Nursing University website also states that they are focused on educating the next generation of nurses and nurse midwives and increasing care availability. This aligns perfectly with Mary Breckinridge, since her life's mission was to increase midwifery care availability. Additionally, Frontier Nursing University also focused on providing distance online learning, making their education more accessible to students. Mary spent the remainder of her life fundraising and traveling. She also published an autobiography called Wide Neighborhoods, a story of the Frontier Nursing Service in 1952. She passed away in Hyden on May 16, 1965, according to the Encyclopedia of Arkansas. And here are my resources.